Good day everyone, my name is Erich Catig, a caregiving student of St. Augustine School of Nursing, Quezon City. For today's video, we will be doing the written demonstration for supplying oxygen inhalation or oxygen administration. It is a method by which oxygen is supplemented at higher percentage than what is available in atmospheric air, usually given to clients with difficulty of breathing and respiratory problems. The purpose of this procedure is to relieve dyspnea, to reduce or prevent hypoxemia and hypoxia, and to alleviate associated with struggle to breathe. The sources of oxygen are the following. There are therapeutic oxygen, which is available from two sources. One is the wall outlets, and the other one is the oxygen cylinders. This is the one that we'll be using today. So, in order for you to do the procedure, please, you have to take note of the following. We have to explain to the client the dangers of the lighting matches or smoking cigarettes, cigar pipes. Make sure also to keep safe the possible source of fire. Place a warning sign of oxygen or no smoking, and do not use oil on oxygen equipment. This oil is a really source or ignites fire. With all oxygen deliveries, make sure to turn it on first before the mask applied. Make sure also to check the tubing if working properly. Then maintain a constant oxygen concentration for the client to breathe. Give also pain medication if needed to prevent from chilling, and try to ensure the client gets needed rest first when the client's physical need is important. Watch also for the respiratory depression or distress. Encourage the client to move about in bed to prevent hypostatic pneumonia or circulatory difficulty. Provide also frequent mouth care. Make sure that the oxygen contains proper humidifications because oxygen can be drying the mucous membrane. Discontinue oxygen only after a physician has evaluated the client. Generally, you should not abruptly discontinue oxygen given in medium to high, which is about 30 degrees. Always be careful when you give high levels of oxygen to a client with COPD. Never use oxygen in the hyperventilation client. Wear gloves anytime you might come into contact with the client's respiratory secretions. This is to prevent spread of infections. So these are the following or the materials needed. The client's chart, which is the Cardex, the oxygen connected tube, the flow meter, the humidifier with sterile water, the oxygen source, tray with the nasal or cannula or appropriate size or oxygen mask, the kidney tray, adhesive tape, and scissors. The oxygen stand, gauze pieces or cotton swab if needed, then the no smoking signboard, and gloves if available. There are two types of oxygen procedure. Number one, we'll be doing the oxygen administration using nasal cannula. It has different flow rate depending on the oxygen concentration or by the doctor's request. This is more comfortable than face mask. It will bring less anxiety, allows client to talk and eat, then mouth breathing does not affect the concentration of delivered oxygen. The disadvantage of this one is you cannot assume an adequate breathing and unable to deliver concentration above 44%. And while using the simple face mask, it can deliver high concentration of oxygen more than nasal cannula. The disadvantage of this one is it may cause anxiety, able to lead hotness and claustrophobic, may cause dirty easier, so cleansing is frequently needed, should be removed while eating and talking, then tight seal or long wearing can cause irritation on the face of the client. So these are the procedures. We have to check the doctor's prescription, including the date, time, flow liter, minutes, and method. This is to avoid medical errors. We have to check the client's record first. Then we have to perform the hand hygiene and wear gloves to prevent spread of infection. And we have to explain the purpose and procedure to the patient to foster client's cooperation and allays his anxiety. Hi, good morning, ma'am. My name is Erich and I'm your caregiver assigned today. So let me just check some information. Your name again? Hannah. And your birthday? Okay, thank you. So your doctor advised me to do the oxygen administration today. So this is for you. This is to help you breathe properly. Okay, and then to check your respiration or respiratory. Okay, for you to be able to help you in proper breathing. Are you good with that? Okay, so we'll do the procedure. Then we have to assemble the equipment to facilitate skill in accuracy in performance. We have also to prepare the oxygen equipment. First, this is what we're going to do. Attach the flow meter. One-third with still water or boiled water. And then blow out dust from oxygen cylinder. Then attach cannula connecting tubing to the adapter or humidifier. So this is the nasal cannula. This is what we call the nasal cannula. Make sure this is really sterile or clean before we'll use it to our client. Then we have to test flow by setting flow meter at 2 to 3 liter per minute. This is to provide or prescribe oxygen to the client. So we have to check, open the gauge, and then check also the meter here. Okay. Then adjust the flow meter, setting to ordered flow rate. This high rate may cause excess drying of nasal mucus, so you have to really check what is in the client's order, the doctor's order in the chart. Okay, so you have to adjust. And then we will now insert the nasal cannula into the client's nostrils. I'm gonna insert this in the nostrils.
Ganda niya. Ay.
And maintain the sufficient slack in oxygen tubing. This is to prevent tubing from getting out and leak. So you have to, if tape is needed, you have to do so. But if not, no need for you to put that. Just make sure that the tubing will not go out of place. Then also encourage the client to breathe through the nose rather than the mouth and exhale from the mouth. From nose means inhaling more oxygen. Ma'am, can you please inhale through your nose? And then exhale through your mouth. Inhale through your nose. Exhale through your mouth. And through your nose. So are you feeling better, ma'am? Can you breathe properly now with the help of the oxygen? Okay, thank you so much. So this is to initiate the oxygen flow to maintain doctor's prescription and avoid oxygen toxicity. Just make sure that the actual record or the actual request by the doctor should be done properly so that we could save from any danger or the clients from any danger. These are the procedure in using or administering oxygen inhalation or oxygen administration. So in using also the simple mask or face mask, procedures are similar to nasal cannula. The only difference is the type, the tubing that we will be using. Simple face mask will cover parts of the nose and the mouth of the client when eating or drinking. We will need to remove the mask, clean it and put it back when needed, or upon the request of the doctor. Cleanliness and sanitation is vital for this procedure. So this time, I'll be removing now the nasal cannula. We'll be trying also the simple face mask. So I'll be removing this one. So as what I have mentioned, they have the same procedure except from the type of the mask. So now we'll be using the simple face mask. This is how we will do it. Ma'am, we will be using the face mask on your breathing administration. Okay? So can you lift your head, ma'am? Adjust now. Tell me if it is okay or not. Is it okay? You feel relaxed? Okay, so inhale, exhale, ma'am, as normal. Breathe normally. Okay, are you good? Alright. So one of the most important thing is, so when you use the simple face mask, the execution or administration of the oxygen is really high compared to the nasal cannula. But, so when you are going to, or where the client is going to eat, so you have to remove the face mask, then clean it, then after eating, you have to put it back. So that's the only difference. But administration of that one, or the procedure of doing the oxygen administration is really the same, except for the type of oxygen. Make sure to check the condition of your client before leaving the room in order for you to check the safety of our client. Okay? We have also to document the following: the date, the time, the method, the flow rate, the respiratory condition, and response to oxygen. This is to provide proper coordination of care, since we know that oxygen inhalation can bring oxygen intoxication. And we have to sign the chart to maintain professional accountability. Then report to senior staff to provide continuity of the care and confirmation of client's condition. And also to check the oxygen setup, including the water level of the humidifier, clean the cannula, and assess the client's snares at least every hours. Monitoring water level is really vital. So ma'am, if you need something, or you can not breathe properly, or something is not comfortable, just call us, okay? So if you're not really comfortable with the face mask, okay? Alright. Then make sure also to clean the nasal cannula after use by soaking in salmon water for an hour. Dry it properly. Clean the tip of the cannula by spirit swab before applying to client. And that's it, guys. I hope you've learned something from this video. So thank you so much for watching and have a good day. Bye, guys!